Welcome back to our discussion on REDS. In this section, we'll focus on how clinicians recognize, diagnose, and treat REDS, and how multidisciplinary care supports recovery and long-term health. So, Dr. Casey, how do you make the diagnosis when
Yes, well, I'd love to tell you there's one test that you order and then you just check it and you know. But as you can gather from the discussion that we're having, it's not that simple, unfortunately. And so it's really kind of a collection of pieces of information that you get. The history or what you're talking about with the patient is very helpful because, there's so many systems involved. So as we've mentioned, if somebody comes in with a stress fracture, then of course we're asking about their menstrual cycle, and we're asking about energy, and we're asking about fueling. But you have to, really probe sometimes because you might not get that information. The key questions, about menstrual cycle that I'm asking really are how old were they, when they got their first period. So it is expected or, healthy to get your first period by the time you're 15. If you're 15 or older and you have not had your first period, that doesn't mean anything is terribly wrong. It might mean that REDS is going on, or it might mean other things are going on, but it should be investigated. And certainly thinking about nutrition is an important thing there. Asking about, is this your first stress fracture, or have you had, 5 others and they happen every time you ramp up your training? Asking about, do you feel like you're recovering? Are you sleeping well? From the mental health perspective, all of those different things in the history are important. Then you can do the physical exam, and you might look for, when you're measuring, height and weight and, different parts of their vital signs. Are things looking different? If you're following people over time, especially kids who are growing, have they fallen off the growth curve or really dropped down from either physical last year to this year? That's very important information because, typically you would expect the same sort of pattern or trajectory of growth. And if something has changed, then you want to investigate that. Other things would be just, any signs of an eating disorder, so you're looking for that on exam. And then you have some tests to get, but there's sort of tests to make sure nothing else is going on, right? Because there's no test for REDS. So in blood work, you might be looking at how's their thyroid functioning, because that certainly, if that's off, can look a lot like REDS in some ways. Do they have low iron? As Heidi mentioned, low iron and can occur in the setting of REDS, but it can occur on its own. And they might have a different problem than not having a period. They may be bleeding too much and, losing a lot of iron with their cycle or otherwise. Do they have some type of, digestion or absorption problem like celiac disease? So you're looking for all of those different things, maybe some bone turnover markers, maybe you're checking hormone levels depending on the context. And they're really looking for, are there other causes that could be contributing to the symptoms that they're having? And then finally, you can get some imaging, right? Like you could check their bone density with a DEXA scan. You can look for an injury with an MRI, but none of these, say that there's REDS or not. And you have to put that all together. And almost always, then I'm going to refer a patient to Heidi. So she's going to delve into their, energy needs and their fueling and all of that. Then we kind of put it together and think about, does this, fit this diagnosis?
Yeah, and when you're making the diagnosis of low energy availability, what information do you gather? Do you have like dietary diaries or activity diaries?
First of all, it's really fantastic because, the model that we have in the Women's Sports Medicine Center allows us to really work in this interdisciplinary way. Now, sometimes the entranceway might be through nutrition, and then I'm making a referral. And sometimes the referral is coming from one of the docs who's already taking a history. And so I'm able to sometimes get a little bit more information or different information. So I, too, am going to do a pretty thorough intake going back to the same, when did they get their period? I might even go earlier, like when were their first thoughts of their, recognition of their body movement and, how was their eating patterns even leading up to this time, and age factors into that, and we could get into that too. But I'm going to definitely do a dietary intake. I often ask people to keep a food journal before they come in, and it's not about judging it. It doesn't matter. I'm just here to help them, right? I'm not judging it. I'm just saying, hey, are you getting enough in? And so I'm looking to see, are they getting enough in? Are they eating across, balanced plate adequate from different food groups? Have they tried different food fads for certain lengths of time? Have they ever, engaged in diet behavior? Are they what's their output? If they're an athlete and they have a training plan and they're doing a lot of extra on top of that, or oftentimes what I'll see is that no matter where they are in the season, they eat exactly the same thing. So they're eating the same thing during their off season when they may not be training as intensely, or maybe they're training more intensely, and then as they ramp up and do more, they don't increase their calories. And that, again, that's not intentional. It's totally inadvertent, but it explains why they're in an energy deficit. So there's all different things that we're looking at.
And we've talked a little bit about, all these various symptoms, but are there certain complaints that when somebody walks into your office, like right away you're thinking, this is probably something I should address?
Sure. I think the most common reason somebody comes in to see me that then I think we should address this is with a stress fracture. That because of that relationship with bone health, the nutrition, and the menstrual cycle, we're always thinking about that. But I have noticed it's actually encouraging over time. 15 years ago when I started doing this type of work, that's people come in because they can't do their sport and they have pain and they're not wondering about these other parts of the puzzle. But there is so much more awareness about the triad and REDS, which is great, that sometimes people will schedule a visit to say, do I have REDS? Which really was not the case, 15 years ago. I mean, obviously, because the term wasn't even out then. But that is, I think, really encouraging because they are understanding the connection and then wanting to explore that. But otherwise, if somebody's saying, I keep getting injured every time I try to, train for the New York City Marathon and I ramp up my training, I get, this injury, and I stop having my period, then, that's certainly a clue. But, we have residents and fellows and medical students here within Women's Sports Medicine Center and even our summer internship, and we tell them that we screen everybody for this. And it doesn't take long. It's a few questions to get a sense of, do we need to explore this further? Because, as we said before, making a small change and, addressing something inadvertent can have huge impact, not only for right now, but for the rest of their lives. So we really screen everybody.
And what's really tricky about this, from a nutrition standpoint, even when I do an intake, is it can be as low as 350 calories, but chronically over time. It's never one day, by the way, right?
Yeah.
It's not, It's never one day. But it's hard to really, because it's difficult to keep an accurate record, right? How do you estimate really what you're taking in? And I'm not sitting with them. And even if they send me pictures, it's very hard to calculate when it's a low difference. But it's usually, so it can be as simple as adding an afternoon snack. Like it could be as simple as making sure you get in a recovery snack after that workout, right? Or fueling during your activity, depending on what it is. And then other times it's way more obvious, right? You can see it based on skipping meals or diet behavior and things like that.
Well, when would a patient know, like, they should seek medical care? For example, if somebody comes to see you for nutrition advice, like, at what point do you I want to refer to Dr. Casey? Like, what are the things that would sort of trigger
Well, I think it's some of the symptomology. It depends if they're coming to me with labs, or I feel like I need some more information to help understand what's going on because it's not as obvious. I don't think it's ever too early to seek out help around some of these things. The trouble is, as we said, it can be multiple things. Like if you're not sleeping and you're tired, that's not a surprise, but why aren't you sleeping? And actually being in low energy availability can impact your sleep. Right, but so can other things. So
I think also there's so many misconceptions even sort of in the medical community, let alone the athlete, coach, family community that we know within women's sports medicine that we're going to sort of refer, back and forth to investigate things. But I hear still, as I said, there's more awareness of REDS, but I always will hear, if I see an athlete who's 16 and they're a highly competitive gymnast and they haven't started their period, and I'll say, here's something that we might want to investigate this for these reasons. And they'll say, well, we talked to her pediatrician or her, our primary care doctor, not to throw anybody under the bus, but they'll be told, that's because you're a, high level athlete. It is very common for high level athletes not to get their period by the age of 15. It is not normal. It indicates that there should be some investigation of, fueling and eating and other processes that could be contributing to that. Because as we said, this is your only chance to build bone for your entire life, and we don't want to miss this opportunity. And so there still is that sort of idea that, yep, that's just how it is in sports and athletics. And, so ideally, by people understanding this more, if that's ever coming up, certainly abnormal, the time starting of menses, but, fueling and questions about energy levels, those always are indicating, hey, let's get some investigation. It doesn't have to be a big, scary, thing, but making sure that we're fueling well and addressing any other problems that could be contributing are really important.
So yeah, it sounds like a tricky diagnosis. So when you're trying to distinguish between REDS as the cause of fatigue or poor performance versus other things, is it sort of a constellation of things you're looking at, labs and symptoms and all that, or is there one thing you kind of hang your hat on?
Yeah, it's very muddy sometimes when you're trying to differentiate. The easiest scenario, I guess, or the most clear would be I'd see somebody who comes in and say, my energy is low. I don't feel like I'm, recovering and getting as much out of my training as I used to. We would check some lab work and they'd have low iron, let's say. And we also find that they've been bleeding more heavily or longer in their menstrual cycle. So we have a scenario that makes sense. And I would send them to Heidi and, she'd look at what their intake is and it looks pretty good. It doesn't seem, like there's any major areas for improvement there. Well, then that might be the more clear scenario where we would say, hey, the energy, fatigue may be due to low iron. And then we work on addressing the cycle and, certainly supplementing with iron, optimizing their fueling. It's often not that clear because things can coexist. I think the hardest one is exploring REDS and overtraining, and there is some new literature out that's kind of trying to help differentiate that. And overtraining is in and of itself complicated. There's sort of overreaching and all the way to overtraining syndrome. It's on a spectrum. But the important thing to know is you cannot have REDS without low energy availability, right? So that piece is constant with REDS. You can have low energy availability and look like you have overtraining, but you have to address the energy piece as part of that treatment. If you have, somebody that is overtrained and really not, improving in the way they think they should, but their nutrition seems okay, then you have to focus on other things, and it may be workload, giving more time for recovery. It may be working with a psychologist and kind of the mental health aspect of that. We wish there were very clear buckets that you could, figure out where people belong, but there's a lot of overlap.
And to that point, how do you treat somebody who comes into you with REDS? What is your first approach? Is just assuming it's not intentional and giving them ideas on how to get adequate calories in?
Yeah. I mean, it's really, you have to meet people where they are.
Mm-hmm.
You have to pay attention to what their food preferences are and their culture and their schedule and their affordability and access. And so there's a lot of education that goes on. And it's really partnering with someone to figure out where they're able and willing within their day. And it may seem intuitive, but it's actually not, right? We get into our patterns or we learn certain behaviors that we think are working for us and don't realize sometimes it's sabotaging or it's just not intentional. And we talked before about this idea of intentionality. There's a very, for good reason, intuitive eating, a very popular it's not just a theory, it's sort of a method of helping people eat to more satisfaction, but it doesn't really, that's not great for athletes, because sometimes, although food is pleasure and food is celebratory, food does a lot of things in our life, it's also nourishing, but it can sometimes just be functional. And so that's kind of tough for athletes sometimes, because it is like sometimes just have to be functional, and like, here's when you can eat, so you have to eat now in anticipation that your training is in an hour and a half to 2 hours from now, or here's when your recovery is, even though you're not hungry, and then you'll eat again in an hour and a half, as opposed to I'll just wait and eat till later. But because of how caloric intake works throughout the day, and fueling your body, and sort of this idea of caloric distribution throughout the day, sometimes you just have to be really functional in planning. And then figuring out what you can carry with you, portability. Are you eating on the road? Are you eating at school? Are you in your home? So there's like all of those details to fill in around it. And then if there is an element of, I think, again, it depends if they're in a structured athletic setting or if they're training on their own. Some people think, it's just go hard all the time, personal best all the time. And there is this balance between how much you're putting out and how much you're taking in. And so sometimes I'll refer someone to performance and say, hey, I think this person would really benefit from a greater plan in their training, because they're just putting in the miles without doing hard, easy days, or, learning how to do intervals or hills in addition to slow, steady state, and figuring out when to put in strength training and rest days and recovery, which are more popular concepts now, but not always easy to do if you don't have a plan.
To that point, can you speak about the various healthcare providers across disciplines and how they come together to treat an athlete with this?
Yeah, so the ideal way to treat somebody who's dealing with RED-S is a team-based approach, which is, quite frankly, one of the more gratifying parts of this type of care, because I get to then collaborate with my colleagues in working towards, this athlete who's sort of in the center of the treatment plan, and then the people, the support team around often includes, often a sports medicine physician or somebody who has a lot of interest and expertise in this area, a sports dietitian. As Heidi just mentioned, we often will work with performance, so an exercise physiologist, or someone who can really help with like tailoring the training plan and how we're making sure that when the plan that then matches the nutritional needs and demands. So working on that piece of it. Oftentimes, a sports psychologist, or maybe even a psychiatrist or psychologist with a lot of expertise in an eating disorder or disordered eating may be in the mix. We're oftentimes talking with someone's gynecologist. We haven't mentioned this yet, but one of the ways that people will often sort of get treated with this is being put on some type of hormonal contraceptive. And that is not ideal for this treatment, because the issue is low energy availability. So putting somebody on hormones because they have low hormones because they're not eating enough, it doesn't end up fixing the problem. But that has been a common practice, and is changing over time. So a gynecologist may be somebody that we're speaking with. And, strength and conditioning coach that they may be working with. So it is a large team depending on the need. And then you have, oftentimes the family, parents, caregivers, coaches that need to be part of the conversation if the athlete gives permission, of course, because it requires a lot, sort of a community to work with athletes on this. And ideally, that's what gets them the care that they need.
Got it. It takes a village to treat RED-S.
Yep.
And Heidi, what does recovery look like? How long, do you typically see it takes before somebody, if they are now fueling adequately, before they actually notice changes?
I think that depends on how long it's been going on, how entrenched the behaviors are. So I can't give a number to that, and because it is all very individual, and it depends again upon the symptomology. Is there a stress fracture and return to play? They haven't had to step out of their training yet. But people can begin to feel better pretty quickly. But returning, let's say if they've lost their period, that could take 6 months before we even when they start it takes a little while to ramp up to refueling. And then it can take up to 6 months to get their period. And then, the evidence supports that they really have to have sort of that bath of hormones going on to make sure they continue their period before they can see changes in their bone health. So that can really take
Years
to
potentially.
Again, depending upon how long it was they were in the low energy state.
Yeah.
So it's really different. But in terms of the immediate feeling and being able to see training adaptations and brain fog lift and sleep improve, that is really pretty rapid if they're able to do it that easily. And that pace is really also, some people do better with weekly meetings. Some people it's every few weeks because you got to give it some time to do it and come back with whatever the challenges were. And then as it's going on, those meetings can become less frequent and check-ins, and they're just in it.
Right. And Dr. Casey, can you outline sort of the short and long-term consequences of REDS?
Yeah, so the short-term consequences are what bring people in: an injury, as we've mentioned, a stress fracture or otherwise, not feeling like they're getting as much out of their training, maybe some of the brain fog, fatigue, those sorts of things, getting recurrent illnesses. Those are the short-term effects. But as we've mentioned, we're also thinking not only about what the athlete's health is when they're sitting in front of us, but what their health is for their lifespan. So REDS and having a kind of a chronically low energy availability, as we mentioned, influences reproductive health. So if you are not getting a period, then at some point, if someone were to decide they wanted to start a family, that could impact, their fertility. Also, if when the athlete was a teenager, they were having low energy availability, they didn't build as much bone as they might have had, kind of genetically, if they were fueling optimally. Later, when they're in peri and postmenopause, they're starting from a lower place. So as you start to lose bone, as estrogen declines in menopause, you can kind of lose it a little bit quicker, or be greater risk for fractures at that time period later in life. So those are certainly all things that you can see. You can also see people stop sport, because if it's not as fun and you're not getting as much out of it, and you have all of the downsides that come along with REDS, people may quit. And that's, we want people to be active and enjoying the things that they love to do. And so that is a downside that it's hard to capture in research studies, but I think is a real downside.
And to both of you, how would somebody find a specialist who can treat this?
I think the easiest way would be just Google the term and try to look for, it's not only certainly in academic centers, but that's where you'll find often interdisciplinary teams. So like here at the Hospital for Special Surgery, we have the Women's Sports Medicine Center, where there are all sorts of colleagues that work together on issues like REDS. You can go to sort of medical society websites for sports medicine. There's a very nice website, the Male and Female Athlete Triad Coalition, that provides a lot of education, but also a link to say, this is my zip code, what physicians at least are, I think, and sports dietitians, maybe sports psychologists in addition, are in that area. So those are some places to start.
Yeah, I think you really want to look for a sports dietitian to begin with, not just a dietitian, and then you just ask, are you REDS informed? Not all sports dietitians work with REDS, though more and more are aware now, and certainly not all work with eating disorders. So if that's the issue, their eatright.org does have a find a dietitian part to it, and then you can specify sports dietitian, and again, also just in your local communities, looking through for a sports dietitian or through a university, and that person may or may not see people privately, but that might be a good way to get a referral.
Yeah, got it.
And looking for a primary care sports doc, not just a primary care doc, is a better probably bet that they'll have a sense of it.
Yeah, I would imagine it's not everyone is so informed
Right.
about REDS.